Okay guys, so today I'm going to be showing you how to set up a dental dam. It is actually easier than you think. And yeah, so I'm going to show you the basics. Before you set up the dental dam, you have to know how to put this and where it goes. So it does not go like a bridge. This is not a good way to do it. It goes like this, like a U. And do you see how it kind of protrudes like a little pregnant belly? So this is good. Their chin is gonna go right here behind this. That's why it's protruded like this, because their chin is gonna be here. Therefore, you have to set up the dental dam with this side facing outwards. So the trick about this is that you do not want it tight. Do you see how this is tight? You don't want it like that. You want it kind of loose. Okay, so you grab one end, you hook it on there. One end, you hook it on there. You grab the other end, you hook it on there. And then this end, you hook it on there. This end, you hook it on there. Voila. You want to make sure that you have room in the middle here to do this, because this is going to make sure that it's not going to be so tight on the patient's mouth. So you can even adjust it by making this the middle a little looser. Do you see how there's all this space here? That's what we want. Yes. Okay, so now we have to poke a hole. With this dental dam, the easiest way that most people teach it is to poke a hole in the middle, but sometimes that doesn't always work because, yeah, sometimes it just doesn't always work, okay? What you have to think about, and I know they don't teach this in dental assisting school, but there is a circle here. Imagine a fake little oval here. I'll probably insert a little picture here. So it goes 1, 16, 17, 32. So it makes a whole circle right over here. Because remember, the lips are going to go right here, and you're going to be trying to clamp the tooth by pushing this in. Okay, so first you have these clamps to choose from. These are the basic clamps. My doctor likes to use these pretty regularly unless special tooth needs special attention, aka it doesn't fit, or the tooth is too small, or something in that nature. So as you can see, we have all of these beautiful little clamps here. And I know they might look all the same to you at first. I know they did to me, but that is not the case. Okay, so as you can see, this is the only one that looks really different, so I'm gonna set that one aside. All right, and I'm gonna group them. This goes there, this goes there. The only difference is this butterfly clamp, that's right, it looks like a butterfly. This one is for the anteriors. Anteriors on the lower and on the top. So yeah, these go on the top or the bottom. And then I'll show you how to set this one up in a bit. And then these, you see how these little teeth, I call these a teeth. These teeth are smaller than, say, these teeth. Do you see the difference? These little things are smaller, these are bigger, especially this one. Okay, so this one is tiny because this belongs to premolars. You put these on premolars, and these can go on either side, top or bottom premolars. These with the big teeth, these are for the molars. So as you can see, both of these teeth are the same size, meaning that these are for lower molars only. Okay, which brings me to these. Do you see how this one has a big side and a little side? So that means that it's for the uppers, same as this one. Little side, long side. These are both for upper molars, and this is for lower molars. So you might be asking, why is there a small little side to these clamps? Well, I'll let you know right now. This little side is meant for the palatal side, and this side is meant for the buccal side. So now I will show you how to set them up. Okay, so let's say, for example, I'm going to be doing tooth number 2. So I'm gonna grab my little thing right here. I'm gonna face it towards me. I'm gonna look to where it is 2, and I'm going to stamp it. The ones on 2 are usually further, a little closer to the axis of it. And then I'm gonna put it right over here, a little to the side, a little further away from the middle, right over here. So now I have my hole. Okay, and then which clamp are for the uppers? It's the one that has the little and the big side. Now remember that the palatal is on the inside, so that means that this clamp is the one that we're going to be using. So remember, the small side always goes towards the middle. This is the middle. These are for top, so the bow always goes down. Little side towards the middle, it's for that side. This little side towards the middle, it's for this side. It's like this. This little bow goes the opposite way of where the tooth is. So if it's an upper tooth, the bow is gonna go down. If it's a bottom tooth, we're gonna, of course, use the one with the equal sides. And since it's a bottom one, the bow is going to be facing the top, like this. This is a good example of tooth number 30 or 31. Okay, now you may be asking, what about this one? This one's weird. How the heck does it go? Well, let me tell you. So first, I'm going to get my little hole puncher here, and I'm going to put it to a slightly smaller setting because anteriors don't, they're not that big. I'm going to do number 11.
Hey guys, I just noticed a couple people who I want to give a shout out to, and that is Royce Ryder and Can You Feel the Powells. So you should go check out their channels, and I'll put a picture up here. Thanks for supporting me, guys.
Okay, so this is for number 11. So again, look at the circle, and I plugged it close to where the circle is. Okay, so remember, bow, you see how this is a bow. So the bow always goes facing the opposite side of where the tooth is. So number 6 is an upper, which means the bow faces down. But yeah. All right, and how do you do this one? Well, let me show you. So these go where the holes go. You see the holes here? So this goes here, just like that. You squeeze this to make it bigger, and then you tighten it by putting this down. Just like this. And let's just say this hole was poked for tooth number 12. So again, this is a premolar, so we get the little premolar clamp with the little teeth, bow facing down since tooth number 12 is up. And then you see these little holes again. Put it into the hole over here. Put it into the hole, you stretch it out, put it into the hole over here. And that's how it is. And then, so these clamps are gonna go, so you don't wanna put this right here. So these clamps are always gonna go the opposite way of the bow when it comes to these type of clamps. So since the bow is facing down, these clamps are going to face, or these forceps are gonna face the opposite way. See? For number 30, bow is facing upwards, so I'm gonna grab my forceps and do it down, like this. See? Hope this helped you. Okay, bye.